Hi, I'm Colleen Larkin, and today I'd like to speak with you about a topic that is considered really taboo and we often don't hear that much about. It is the topic of circumcision. So, circumcision, to really give you an idea of what it is we actually cut off the foreskin of the male penis, which comes out to be around 24 square inches of nerve endings, muscles, and glands. So, this practice currently is primarily practiced in the United States as well as by Muslims and Jews worldwide. So, one of the things that I like to talk about and I like to bring up are topics that are pertaining to the birth of our children, oftentimes things that we do without really thinking about, without considering where they came from. So, one of the things that I would like to share with you is just where these ideas came from. So, when it comes to Muslims and Jewish people, the practice is grounded in religious beliefs, where in the Bible it literally talks about how Abraham was invited to go into a covenant with God. And in order to do so, he asked of Abraham to circumcise his penis as well as that of his son Ishmael and their future offspring. So this was the literal translation of the Bible. And then when it comes to the United States, it's actually a really different reason that this began. So around the time that birthing began to become medicalized, there was the belief that masturbation contributed to bedwetting as well as mental illness and insanity. And it was believed that if you circumcised the male penis or cut off the foreskin of the male penis, this would reduce the incidences of masturbation, which would then reduce the incidences of mental insanity and bedwetting. Since then, all of these theories have been completely disproven, but yet the practice is still continued. So, dating back to World War I in the United States, they started to have some other medical rationale for the circumcision, believing that it would reduce the number of urinary tract infections, venereal diseases. So when men were going off to war in World War I, men like your brothers or your fathers that were in their teens and 20s actually had this procedure performed at this late of an age. Then when these men came back from war, they had sons and they said, I don't want my son to experience that same pain, so let's go ahead and perform this procedure at birth. And slowly over time, or quickly, depending how you look at it, circumcision became a practice that was really standard in U.S. hospitals, right along with cutting the umbilical cord. So since then, all of these medical justifications have been disproven. The practice of cutting off the foreskin of the male penis is actually quite painful, and the American Medical Association has put out statements, and their view on circumcision is that it is in fact painful to the newborn, and there's no medical justification for having this procedure. But yet still a large percentage of the population in the United States continues to do so. So this is just to share some of that information with you, get some of that information out there to you so that we can all make the best decisions for ourselves and for the people that we love. In the Western culture, we're really used to referring to female genital mutilation as cutting off the clitoris of the woman or girl. But when it comes to cutting off the foreskin of the male, we have a nice name for that called circumcision. And so to really just dig a little bit deeper and try to understand where this history comes from and why we're making the decisions that we are. Hopefully, when we look at these issues, we're able to make better decisions and move forward with an informed mind. So I want to thank you. I want to thank the people who asked me to speak to this topic, and I would like to thank Harvey Kipnis for his research on this topic as well, that really greatly inspired and gave me some base information to begin to share about this topic. And I look forward to being with you again next week and to sharing with you another practice to help you support you either in your pregnancy or in making informed decisions about pregnancy and the birth of your child. Thank you so much, and we'll see you again next time.